Yeah, I hear you fine.
Excellent. Okay, go ahead, ladies.
Hello, thanks for joining us today for a brief COVID vaccine Q&A segment. I'm Barbara Ryan, Director of the Nursing Division from the Shenango County Health Department. Thanks for your continued collaboration with us throughout this pandemic. You are a trusted source for patients. We must give consistent messaging to get more people vaccinated. I would like to introduce our speakers, Dr. Scott Cohen, Medical Director of Shenango County Health Department, and Dr. Heather Parisi, pharmacist of Bartles Pharmacy in Oxford. And the questions will be presented by Chrissy. Chrissy, I'll let you introduce yourself.
Hello. All right, we'll take a stab at the first question. We've been getting a lot of different questions from the public when we do our contact case interviews. So we thought we'd take a few of those and kind of answer their concerns. The first one is it true that the COVID vaccine can cause infertility in women? That seems to be a big hot topic.
You want to take that one, Heather, or you want me to?
I can start off, but I'm sure you've probably got more information. The CDC shows that there's no evidence of infertility. I don't know that Dr. Cohen is big on Facebook, but I know that that rumor kind of took off and gained a lot of traction on social media. So I'm sure that's the source of a lot of that. But from everything I'm aware of, that the CDC has shown that there's no evidence to indicate that at all.
Yeah, that's true. The CDC has shown that. What I'm probably more aware of is the genesis of this myth. And the genesis, from what I understand from doing some reading, is that there was a protein in in these vaccines that is somewhat similar to placental tissue, and there was some concern that because of that you could develop placental antibodies, human placental antibodies. It turned out that that was a rumor started by an aggravated Pfizer employee who subsequently left the company and kind of trying to put a kibosh on the success of the vaccine. So there is no relevance to it at all, and we can just strike that myth completely.
Okay. Onward to the next one. If you have already had the virus, do I still need to get vaccinated? My doctor told me to wait 5 to 6 months.
Well, I can start off with that one, I guess. So, in the past, we used to say wait at least 90 days because of, initial worries about, hyperreactivity to the vaccine because of a recent antigen exposure related to the virus itself. There has not been that realization of fact. So we are now saying that the virus itself, we now know that the virus itself is not enough of a protector to last more than 90 to 180 days. We don't know exactly how long, and in some people, the antibodies don't last all that long at all. We do know that the combined efforts of a vaccine, of a virus exposure causing, significant COVID, plus a vaccine, are a really good protector against further viremia. So, we do tell people if you've had COVID, you're probably okay for 90 days, but there's no reason not to give the vaccine before 90 days. So I am now recommending people don't wait 90 days, just get it when you can. Is it wise to do it less than a week? Probably not. I mean, it doesn't make a lot of sense. But when people are well and doing fine, absolutely they can do it.
And Dr. Cohen, could you maybe speak to the monoclonal antibody that those folks do need to wait the 90 days? I think there's some confusion around who needs to wait and who does not need to wait.
Yeah, so I mean, my understanding is probably the same as yours, Heather. There are very few absolute contraindications to the 3 vaccines, Moderna, Pfizer, and the Janssen. One is anaphylaxis to any of the components in it. I mean anaphylaxis, not, I got a hive or something. But really also, if you have current COVID, obviously you shouldn't get the vaccine. or if you're on quarantine for suspected COVID or exposure, you should not get it. Or to Heather's point, if you've gotten a monoclonal antibody infusion within the last 90 days, I strongly recommend you don't get it. Not because it's a problem, but because it's likely to be ineffective, because the monoclonal antibodies will more than likely bind the antigens in the, that are produced. So I don't know, is your thought about the same with that, Heather?
It is. And usually when people say, oh, but I did have COVID, I think I should wait, or, my provider told me I should wait, I then proceed to ask, well, were you hospitalized? Did you receive any treatment other than, symptomatic treatment for COVID? And when they say that they were never hospitalized, they didn't need any type of supplemental oxygen or anything else, I feel pretty confident ruling out that they did not receive monoclonal antibodies, and encourage them, as soon as they feel well and are released from quarantine, they should go ahead and get vaccinated.
Absolutely.
All right, the next question was from a pregnant mother. So my doctor told me to wait until after the baby was born to be vaccinated, and she was 6 months pregnant.
Yeah.
I think there's been some confusion with that.
We strongly recommend that pregnant women get the vaccine. There is a worse outcome in pregnancy with COVID, so we strongly recommend that. Some people do worry about the first trimester because of neuro and other developmental processes going on in the embryo. Even that, though, has not been proven to be a problem as we stand right now. I usually tell people talk it over with your OB, but we do strongly recommend that you get it. If possible, and you can isolate yourself strictly for the first trimester, waiting until after the first trimester is probably the best, but it is absolutely not necessary. And the risk of COVID is much higher than the risk of, getting the vaccine. The reality is too, if you do get COVID, then the baby has some passive antibody immunity for quite a while as well, up to 3 months. So Heather?
Yeah, I was doing some research and I just came across the ACIP just recently did a data review, and it was over 30,000 women who were either pregnant or breastfeeding, and they found that there was no increased risk of either side effects or negative outcomes versus a control group. So I think that 30,000 people through the VSafe program, and the VSafe program has that special pregnancy registry, that there's definitely a lot of documentation out there, and that should help alleviate people's fears. But I think obviously a newborn is too young to be vaccinated themselves, so any kind of passive immunity mom can protect is just another way to protect your unborn baby.
Absolutely.
Okay, the next one is about the Johnson & Johnson vaccine. Some people really wanted that one shot, but they were worried about the blood clots. And what's the easiest way to approach that and the thing to say to patients?
Dr. Bartle, you want to take that one?
We definitely saw that in practice. People were very concerned after the pause. We had people definitely cancel appointments, and I can understand the hesitancy. The pause was not a recall. It was not anything like that. It was just a chance to review some of the data. And I was fortunate to be on some of the CDC calls where they had indicated, this was 6 people out of over 7 million doses administered. They were all at that point in time females of childbearing age. There did not at that point in time, and I'm not 100% certain whether anything's changed since I've last checked, but they were not all on oral contraceptives. They were not all smokers. There did not seem to be any defining factor. So I think kind of the takeaway is that this was a very specialized type of clotting that was happening. This wasn't, a random DVT or anything that was happening. Again, the VSafe program is critical to catching things like this, and the VAERS system as well. So they had some really astute providers who were recognizing that this could be vaccine related and reporting that information. So I think as providers, that it's definitely something that we all need to be mindful of when someone does report, a lesser known adverse reaction. We've had all those people pretty much come back and feel confident getting the J&J vaccine since then. And I have a good level of confidence in administering it to patients as well.
Yeah, as do I. as Heather said, the J&J vaccine did have a small number of these unusual, I think it was cavernous sinus blood
Yeah.
clots. You know, it's quite a very unusual thing in a very small population, typically in a population that has some hypercoagulability, but not with the excess risks with smoking or oral contraceptives. That said, we do know that there, 100,000 people or more have had blood clots related to COVID. We know that COVID is thrombogenic in and of itself. I don't know of the data related to cavernous sinus thrombosis, in patients who've had COVID, but even I personally have had, patients with blood clots associated with it. We don't have a good amount of data to suggest why this happens, but I suspect, the antigens somehow promote thrombogenesis, and probably those people would have been some of the people that had blood clots had they gotten COVID as well, just because of their reactivity. Similar to strep and scarlet fever and rheumatic fever, things like that, the cross reactivity of antigens. That said, the numbers are extremely low, and I really do have good faith in the J&J vaccine.
Okay, another person said they were really scared of the side effects of getting the vaccine. Is there one shot that's better over the other as far as side effects?
Well, the side effects of the vaccines, all three, are significantly better than the side effects of COVID. I will leave it at that. That's the easiest way to look at it. The other is, interestingly, and Heather probably has more experience in this than me because she gives so many of the Shingrix vaccines. So Shingrix is the newer shingles vaccine that has a newer, this adjuvant in it, and I forget the name of it, but this adjuvant hasn't been around all that long. It's somewhat, it's an adjuvant that causes a lot of inflammation, but it's probably the reason the Shingrix vaccine is so effective. What I've seen is the vaccine-related side effects associated with Shingrix are very similar to those that I've seen with J&J, Moderna, and Pfizer vaccines. They're minimal. Yes, you can have fevers. Yes, you have body aches. I actually worked from home the second day after my second Pfizer vaccine because I felt like I'd gotten run over by a bus. But so what? Better that than, winding up in the hospital. You're not going to grow a third arm or have your DNA change and turn into a giraffe or, something like that. So, no,
Is your arm going to become magnetic?
something like that. That would be very nice. Heather?
I agree. I haven't seen anybody really have, significant difference from one vaccine to the other. I think, unfortunately, the Moderna has kind of gotten a bad rap for that second dose. People say, oh, it's really going to, kick your butt. You're not going to feel well. And we've had people apprehensive about getting their second dose, maybe based on the timing, especially now coming into graduation and wedding season and things like that. People are a little concerned about the timing of their second dose. And I always try to phrase it that, congratulations, you had an immune response. Like, how lucky are you that the vaccine is providing you some level of protection? We worry a little bit as people age that, they don't form that same immune response because their immune system has just gotten older and it doesn't respond as robustly as someone who's younger. So I know it's hard and difficult to think about not feeling well for a day or two, but it's definitely one of those things that it's a sign that the vaccine is doing exactly what it's supposed to do, and it's offering you level of protection.
Okay, the next question. Long-term side effects of the vaccine don't seem to be known, so I'm waiting to get vaccinated. How long should I wait?
Could probably get it today. I would wait about an hour. Is my So this goes through the whole thing of how the vaccines were approved, and I hear this is not politics. I work with the health department as a medical director, working with Mark and Heather. By the way, is not Heather is also obviously a PharmD, local pharmacist owner, but also works with the health department extensively. And we've looked at this. The way these medications were approved on the emergency use authorization was a really good process. This is not a political thing. The reason it got out so quickly were really three major things. One is money, meaning we threw money at it, whereas we don't have the budgets that we normally do for new drug approval processes. Number two is that the number of applicants for the volunteer pool for each of these was enormous. And I read some news accounts of this where people were asked why they volunteered, and they said, I'm sitting at home doing nothing, and all these healthcare workers are saving people's lives, and I want to do something. And there were some people who just wanted early access to a vaccine. Okay, I get it, or possibility of that. But the reality is, tens of thousands, 44,000 people per were able to get this because it was pushed forward so quickly financially. The third part is, and Heather can tell you this much better than me, the FDA, the ACIP, and other organizations that regulate and approve vaccines are awful. I'm involved with multiple regulatory agencies. They do things in their own time. But one thing that was done by the federal government is they said, nope, if you have the availability to look at something, you're going to look at it then. If you have the ability to approve something, you're going to either approve or deny it then. You're not waiting until your next meeting. So those three things came together to make these things come out quickly, not because they rushed them through and said, we're just going to put them through and implant microchips in people because we want to track where people are going. That is just not the case. Anything else on that, Heather?
I totally agree with everything you said. I think it's important for people to understand that no phase of the trials were skipped, they were just allowed to participate simultaneously. And from a drug manufacturer, normally they're looking at what's their return on investment going to be, because at bottom line, as Dr. Cohen said, it's all about the money. So they're not going to move into phase 2 until phase 1 is cleared. They're not going to move into phase 3 until phase 2 is cleared, just due to the financial jeopardy they put themselves in. So when the government backed this financially and said, green light, go, get everything going, they were able to simultaneously run multiple phases of the same trial, which is why things happened so much faster than they normally did. I think it's really important to stress that nothing was skipped. Everything was handled the way it normally should have been. And Dr. Cohen's exactly right. The regulatory agencies are just a nightmare to deal with. And so the EAU just basically says that the benefit outweighed any risk at the time, and kind of will deal with the paperwork at a later date.
Okay. The next question from the public was, does the vaccine enter your cells and change your DNA?
Yes, we need a new April the giraffe. So we're trying to generate more giraffes for the park down in Binghamton. No, and Heather is much more, in tune with the biochemistry of this at all. But the messenger RNA does enter your cells, and it does cause a brief reduction of this protein, basically the spike proteins that are the antigens that we form antibodies and cellular mediated immunity against. That said, and then that dies out and it's done. That said, it does not change a human body's DNA whatsoever. Heather?
Yep, totally agree. Does not enter the DNA, neither the adenovirus or the mRNA vaccines enter the nucleus where your DNA is stored. So the mRNA is basically just instructions. So it's as if Dr. Cohen back in the day writes me, the pharmacist, a hand prescription and tells me, what I should do, what he'd like his patient to do. Once I'm done with that, I can then rip that up and throw it away because our mission is accomplished. We took care of that patient. So the mRNA technology does not even stay. Your body discards it after it's interpreted the message that was sent. So there's absolutely no impact on your own DNA.
Or you just throw it away because you said you couldn't read it. But that's okay. I'm sure
Not
Marty's
you.
handwriting or Paul is probably not much better.
Okay, we have 3 more questions, 3 more entertaining questions for you.
What was that, Marty?
I'm stuffing my face becoming with a mouthful here. I'm eating.
Can't really understand you, unfortunately.
But I can hear you.
Huh. Okay. Sorry, Marty.
The next one is, I think the vaccines contain chemicals, medications, and other controversial substances, such as aborted babies. How
That's
do
you,
address that issue?
That is a big no. Again, I'm not sure the source of where that originated. I'm sure there is some large anti-vax group that, wants everyone to believe that you're from an ethical standpoint, doing something wrong by getting vaccinated. The great thing, there's so much information on legitimate websites such as the CDC that actually lists the actual ingredients in each of the vaccines, that people can research and check that out on their own. There really is nothing unusual in any of these vaccines. So that's a big myth.
Okay. Next question is, I still keep hearing that this is just like the flu, and the shot is just like the flu shot. I guess people are still comparing them. What do you say to those patients?
Well, it's just not. I mean, you know, again, that's politics. You know, influenza is a virus that kills on average 35,000 people a year, some bad years up to 50 or 55,000, about the same number as people who die in car crashes every year in the United States. The flu virus itself generally changes every year due to antigenic drift. We typically get, you know, the virus that comes from China, Australia, and elsewhere. So we kind of have some idea of what the new antigens are going to be. So the vaccine is formulated that way. Unfortunately, flu vaccines don't protect well year to year, meaning the antigenic drift is enough that the flu is able to evade the immune system. That's why we have to get flu shots every year, at least one of the reasons. It turns out that's probably not true for this. You know, COVID-19 disease tends to be very well prevented with almost all the vaccines. AstraZeneca, we're not 100% sure yet, but almost all the vaccines, even in its variants, be it the variant from, you know, from the UK or from South Africa and others, you know, what we find is that, yes, the South Africa variant, I forget which one that is, but that variant, you know, requires a higher titer of antibody to neutralize it, because it's so different than, you know, the original wild type and also the one from the UK. But the reality is that the vaccines produce such a high level of antibodies and cellular mediated immunity that it overcomes that need for a higher titer of antibodies. And that's the way I explain it to patients. I don't use, obviously, some of those terms that we use with each other, but I don't know, Heather, if you have anything more to add on that.
I think the great unknown with COVID is that, you know, we've seen kind of anomalies at both ends of the age spectrum. You know, I can think of somebody 80 years old who did completely fine. You know, for him, it probably was more like flu-like symptoms with the fatigue, malaise, you know, things like that. But then you don't have to look very far to find someone young, you know, otherwise healthy, who has had a terrible or fatal outcome from it. So I think there really isn't any way to proactively predict who will get really ill and who will do okay with it. So I think that also has to be factored in. And I think that it's something that you really have to think about your home situation. You know, who are you being exposed to, whether there's small children in the home that can't be vaccinated, high risk, you know, elderly parents and caregivers, and the nature of your work. Just something that I feel morally responsible is by hopefully not spreading the vaccine or not spreading the disease by being vaccinated, that I'm protecting my community as well. And I think that we all have a moral and ethical obligation to help protect our community as a whole.
Okay, our last one, you spoke to this a little bit already, but I'm hesitant to get the vaccine because it is not FDA approved yet.
I think we kind of spoke to that already. FDA approval, as Heather said, it's a paper process. The EUA, the emergency use authorization, supplanted that. Pfizer is working to get, you know, a formal approval for a variety of reasons. One is that you can then mandate it, including the military. So they are going to mandate it in the military. But honestly, it's a pro forma at this point. It really is.
Yeah. I think that there's so many aspects of our life that day to day we trust science. You know, I know we have some pilots here, and, you know, I wouldn't get on an airplane if I didn't trust the science, you know, the science of that plane being able to stay in the air. You know, we wouldn't have this conversation if we were talking about some of the off-label prescription medications that we use. you know, they are not technically FDA approved for things that are being used every single day. And I think that this is one of those instances that you have to put your trust and faith in science.
Okay, thank you. That was our 10 questions that we had. I'd like to open it up to anyone that has another question. Please unmute yourself if you would like to ask a question.
Yeah, or you can type in the chat, or I guess Marty, I don't know what's going on with your mic there, but you can probably call my desk phone at 547-3446, and I can probably put you on my speaker. That'll probably work as well.
Or anything else, Heather, that you would like to add, or Dr. Cohen, that you think is very important for providers, practitioners to know, to keep sharing the same message to our patients?
Yeah, two really important things. The risks clearly favor the benefit. The risks clearly are outweighed by the benefits of this vaccination. All three of them. Clearly, there is really no doubt in my mind, and hopefully not in all of your minds as well. Number one. Number two, patients listen to their practitioners, physicians, you know, and EPCs. So please, you know, try to work with your patients on this. I really think it's important that we, you know, as caregivers, you know, in Shenango County and other counties, you know, try to tell patients, you know, our feelings on this. I have two colleagues who, you know, got the vaccine in their pregnancies, one at the health department actually, and, you know, one down the street. You know, I really believe in this. And honestly, that's the reason that we're able to go without masks now. But we very easily could have a recrudescence of this disease if we don't do the right thing and get as many people vaccinated as possible. So this is just really important that we serve as the messengers for this. So thank you all for attending today.
Thank you very much, Dr. Cohen. Thank you, Heather. Thank you, Chrissy Arnold, our health educator, for presenting the questions. Thank you, everyone.